Hi, I'm Dr. Ethan Puryear.
And I'm Dr. David Voth.
And I'm Dr. Jeff Laughlin.
And we're the Pediatric Dentists of Virginia Family Dentistry. Today, we want to talk to you about your child's first dental visit and why pediatric dentistry is so important.
It's very important to establish a dental home for your child at an early age. The American Academy of Pediatric Dentistry recommends the first dental visit at age 1 for a child. And a lot of parents may think, well, my child is not going to be able to sit for a dental visit or an exam at that age. However, given our additional training, we have different behavior management techniques that allow us to see any dental concerns going on even at that age. Pediatric dentists have 2 extra years of schooling in a pediatric residency. So during that time, they learn all of the needs that a child may have in terms of their oral health and developmental changes. They have their own set of dental problems along with fears and difficulty communicating that really require special assistance from someone who is trained in pediatric dentistry.
A child's first dental visit for a really young child looks very different than it would for an adult. Most children under 3 will sit in their parents' lap and they will have a brief exam that's mostly focused on identifying early warning signs and then talking a lot about prevention and things that parents can look forward to in the future and things they can do to improve their dental health over time. It's not just about cavities. We also are looking at things like, do they have a thumb-sucking habit? Are they using a pacifier? Do they have habits that could contribute to their growth and development in a negative way over time? We brush their teeth with a toothbrush and paint a fluoride treatment on. Some kids are fussy when we do that because it's an environment they're not used to. So as they get older, they'll become more and more comfortable with sitting in the chair by themselves or different instruments they use for cleaning their teeth, taking x-rays and things like that. We also want to make it fun for them. We want them to get to pick out the color of their toothpaste or the flavor of their toothpaste. At the end, we want to give them a high five, let them get a prize, make them feel good about coming in today. We want them ultimately to feel like they're excited to come to their next visit. It doesn't feel like something where they're getting their teeth cleaned. It feels like a fun experience that those things also happen while you're there.
During continuing care for our patients aged about 5 to about 10, we will typically see the patient every 6 months. At these appointments, we also like to look at the growth and development of the child. We want to make sure that all permanent teeth are erupting normally and all the baby teeth are coming out in the right order. The steps of a continuing care appointment are, once the patient checks in, one of the assistants will bring them back to the treatment area. Parents in our offices are all allowed to come back with their child. Their teeth will be cleaned by a friendly assistant. They will expose any x-rays that are needed. Then a fluoride varnish will be applied to the patient's teeth to prevent cavities in the future. One of the pediatric dentists at Virginia Family Dentistry will perform a clinical exam to make sure that everything looks normal and the patient is totally healthy. At the end of the appointment, your child will be given stickers and tokens to one of our toy towers. We find this is important because it reiterates the importance of dental care and rewards them for good behavior in the chair. All the pediatric dentists at Virginia Family Dentistry strive to make treatment a fun, memorable experience for the child and make sure they develop into a confident adult patient.
Thanks for joining us today.
We hope to see you again soon.
Please visit vadentist.com to schedule an appointment and find a location near you.